veterinary nurse. Coach Salima here with a few more of my favorite intentional movements to help you prevent injury and protect your body while on the job. We're still focused on the back, but today we'll address a series of common muscle imbalances which can lead to poor posture and ultimately back pain. So we'll first work to strengthen the lower posterior chain, your hamstrings and gluteal muscles, and then work to stretch the hip flexors. As always, confirm with a healthcare professional before adding any of these movements to your routine, and if anything causes pain or discomfort, discontinue immediately and seek medical attention. Our first strengthening movement is a standing hamstring curl. Begin in a standing position with a chair or a wall for support. You'll shift your weight over to one leg as you bend your opposite knee, driving your heel up toward your rear. Now make sure that your knees stay in line, pelvis is in neutral, and engage that hamstring muscle throughout. You'll pause at the top, then slow with control, release back to your starting position. You can complete 12 repetitions on either side, up to 2 to 3 rounds total. And as you progress, you can release your hand from your support, add an ankle weight or a band for resistance. For the glute bridge, you'll begin in a supine position with your feet firmly planted in the ground, knees are bent. Now you'll keep your head and your shoulders in contact with the floor as you peel your hips up off the ground. So engage your gluteal muscles as you drive your hips up. Avoid hyperextending your spine, go just until your range of motion. You'll pause at the top, then slow with control, release back to your starting position. You can complete 12 repetitions, up to 2 to 3 rounds. And as you progress, you can add a weight or a resistance band to your hips. Our first stretching movement is a standing quadricep stretch. For this, you'll begin in a standing position with a chair or a wall for support. You'll shift your weight over to one side as you bend your opposite knee, bringing that heel up toward your rear until you can grasp your foot in your hand. Now keep your knees in line with each other, neutral pelvis as you feel that nice stretch in the front of your leg. You can hold for 20 up to 30 seconds, then make sure you repeat on the other side, completing a total of 2 up to 5 repetitions on either side. Now as a progression, you can release your hand from your support. As a regression, you can use a towel to assist in holding that foot. Our final stretching movement is a kneeling hip flexor stretch. For this, you'll begin with one knee firmly planted in the ground. I like to use a little pillow for support. Now make sure that your hip is directly over your knee. Opposite foot comes up in front of you. Both knees are at a 90-degree angle and hips are squared. Now you'll initiate this movement by engaging your core and tucking your pelvis under just slightly. Then glide forward to feel that stretch in your hip flexors. Now if you want to deepen the stretch, you can bring your arm up and over for a reach. You'll hold this for 15 to 30 seconds, then make sure you repeat on the other side, completing 2 up to 5 repetitions on both sides. Now if this doesn't feel good on your knee, no worries, you can bring it up into a standing lunge. So your front knee is bent, back foot is planted, and you're tucking your hips under, feeling that stretch in your hip flexors. Again, you can bring your arm up and over for a reach.